My name is Jonathan Shapey. I'm now a clinical academic and consultant neurosurgeon at King's College Hospital and King's College London. But during my doctoral studies at UCL, I was embedded within the welcome EPSRC Centre for Interventional and Surgical Sciences. And it was during this period that I collaborated with the RSDG. Image-guided surgery is an integral part of modern brain tumour surgery. It allows for smaller, more precisely positioned incisions, and it enables the accurate localization of tumours and surrounding critical structures, which may be at risk during surgery. However, clinical neuronavigation systems are limited by their inability to account for brain shift that occurs during surgery due to a release of brain fluid and tumour resection. Intraoperative ultrasound is a portable system offering real-time imaging and has become an increasingly popular tool within neurosurgery due to its comparatively low cost and real-time feedback. Unlike intraoperative MRI, the use of ultrasound is easily incorporated into the surgical workflow. Several different ultrasound systems have been reported in neurosurgery. However, it remains an underutilized tool because surgeons are not very familiar with it and find it difficult to interpret ultrasound images acquired in unfamiliar planes. This limitation may be overcome by the integration of ultrasound with neuronavigation. Some commercially available navigation systems do have the capability to do this, but no system permits the integration of additional monitoring modalities, such as neurophysiological monitoring and stimulation. Such a capability would be particularly useful in neuro-oncology surgery and skull-base surgery. Skull-base surgery is a highly specialized area of neurosurgery involving the removal of cancerous and non-cancerous tumours located on the underside of the brain and the base of the skull. Skull-base surgery is extremely complex because most tumours are intricately associated with critical neural structures such as the brainstem and cranial nerves and other critically important blood vessels. Vestibular schwannoma is a benign non-cancerous tumour arising from one of the balance nerves and the commonest pathology encountered in skull-base surgery. During vestibular schwannoma surgery, there is significant risk of postoperative facial nerve injury. One of the reasons for this is that it's extremely difficult to visualize the nerve on standard MRI sequences, so surgeons don't know where the nerve will be during surgery. Continuous intraoperative neuromonitoring is used during surgery to help identify the nerve, but it is often unclear how much tumor remains attached. Integrated intraoperative ultrasound and neuromonitoring could therefore increase surgical safety and potentially improve surgical resection rates. The aim of this work is to develop an open source, multimodality image-guided surgery platform designed to integrate with a commercially available neuronavigation system. The system was designed for skull-based neurosurgery, but could be applicable to any surgery where multimodality intraoperative guidance is desired. The RSDG helped work on the integration of different data sources into a unique graphical interface to provide a helpful combined view to the surgeon. To enable streaming of data between devices, a local network was established, connecting 3 hardware devices. Ultrasound data was streamed across the network using our previously published Scikit surgery library, and the PLUS toolkit was used to stream tracking and model data from a StealthLink-enabled Medtronic Stealth Station. Ultrasound and tracking data were received on the client PC using the PLUS toolkit in the open IGT-Link format. A frame rate of approximately 25 frames per second with a clinically acceptable latency was achieved using this configuration. Technical support provided by the RSDG reduced the project's development time and helped drive the project towards completion. The RSDG also contributed to the 3D Slicer and PLUS community by detecting issues and providing implementations to fix them.